This segment of DelmarvaLife is sponsored by For All Seasons Behavioral Health and Rape Crisis Center.
In the realm of mental health, a lot of words get thrown around, sometimes with little regard to their meaning. You'll hear things like psychiatry and psychotherapy, psychiatrist and psychologist. It can get confusing, but these words all mean very specific things. In the case of psychiatry and psychotherapy, there's a strong argument to be made that when combined, the mix of medical support and talk-based therapy can build long-term results. Lesa Mulcahy is the Chief Clinical Officer of For All Seasons, and she's here to explain a little bit more. Lesa, welcome to DelmarvaLife.
Hey, thanks so much for having me.
So when people are in mental health treatment and they're taking medication, do they also engage in therapy as well?
They can, and when combined, psychotherapy and psychiatry can provide what I would say is a comprehensive treatment plan that addresses both the brain and the body. And so if you think about it this way, psychiatry provides the medical expertise for diagnosis, medication management, addressing chemical imbalances in the brain, while psychotherapy or therapy often offers space for clients to process emotions and develop skills. And I think one of the things that's really important to note in these situations is while people who are prescribed medication can greatly benefit from also receiving therapy, not everybody in therapy necessarily needs or benefits from medication.
Okay.
So the goal is really to tailor the care to the individual and their specific needs.
Okay, so how do patients who receive both enjoy the benefits?
So when it comes to mental health, it's really multifaceted. And when we think about medication management, that really focuses on the brain chemistry, which helps people to be able to process information and or use the skills that they develop in therapy. And oftentimes I think about it as maybe building a house. And so therapy will build the walls and the rooms, so the structure of your life and the coping skills. But the foundation has to be steady before you can build safely, and that would be the medication management. And so it just gives people a space to be able to process and hear so that they can communicate to their clinician about the things that they need for therapy.
So, okay, so what is achieved in therapy that helps patients?
So my experience is that clients really learn to understand their pattern ways of thinking and behaving, that they develop a deeper understanding of themselves, their mind and body connection. It also helps people develop new skills that can decrease or manage stress, anxiety, depression, or any mental health concern that they come in. And so I think about it as like the therapist is the guide and helps clients to understand the importance of practicing the new skills or way of being in the world. And then the client, it is their work is really about how do I continue to practice or develop these skills.
Does the combined treatment work for everyone?
So I think that's a great question. Everyone's brain chemistry and genetics and body are different, so it's really not a one size fits all. People's readiness for medication or therapy is also different, and so we have to respect those differences. For us at For All Seasons, it's really about meeting people where they're at and providing the information so that they can make the most informed decision for themselves and find the right provider so that they can communicate their needs. And so again, it's really about individualizing and personalizing the treatment for their needs.
Okay, so where does someone start if they are thinking about doing one, the other, or both?
So you can start, so for instance, at For All Seasons, we have an open access program where they can come in. You just go to our website. They find the open access times that are convenient for them. They would get initial assessment by a mental health clinician. And at that first appointment, basically what would happen is they would talk with their provider and say, I'm looking also for medication management, or would medication management help me as well? And then a referral is made for our psychiatrist team. And at that point, they would then schedule an appointment and then have a medical person talk to them or talk them through what would happen at, like for medication, or because sometimes medication isn't appropriate.
All right. Lesa Mulcahy, Chief Clinical Officer with For All Seasons. Thank you so much. Very important information.
Thank you.